You know that July 2022, WHO declared monkeypox as, something for public health concern. And in Uganda, recently, that was on 24th July, we had the first case in Kasese. To date, we have had cumulative 11 cases across the country. Thank God there's no death. There are no more new cases in the country, but Kabale district, by the nature of its location, we are located in southwestern Uganda, Kigezi region, and we interact closely with the emerging epicenter in the North Kivu, in DRC. So that puts us among the districts or the regions that should be prepared. Kanungu, Rukunjiri and Kisoro are very high risk because they are on the border. But since we're in touch with them, we are also at high risk. And we all know the interaction that we have with the region. The trucks, the buses, the business people. There's a lot of interaction between us and the neighboring districts, but also in the neighboring countries, DRC in this particular case. And so much as we have not had any case, and which is the best case scenario, we want to hope that we shall not have any case in Kabale. It's our desire and other efforts we are putting in to make sure that this does not come to us. But we don't just sit back and hope that it will not come. So we're putting in measures to make sure that indeed it keeps a store of other places and not for Kabale. And that's why we are gathering, we are inviting you as the media people that to help us to start creating awareness, because it's very key that the community is aware of what is this disease, how is it spread, who is likely to have this disease, how does it look like, and what are the risks, it puts on the people who acquire it. So we are meeting here and want to engage you as media people to see that we start together, because you are very critical. When it comes what the community knows, you play a very big role. And as he was saying, some of you sometimes deliberately, pick one thing and exaggerate it, What was not the key point for the day is what you choose to make the biggest headline. So we want to be in this together. We are requesting that we be in this together. So we want you to start, we sit together, we discuss the information at hand together. Where you seek clarity, you shall give clarity such that whatever is going out in the media is accurate about Mpox as a condition, but also Mpox situation in our region and even in our country. So that's why we are here.
My name is Matende Henry. I work with the Ministry of Health. I'm attached to the Regional Referral Hospital of Kabale. Today we are here to talk about Mpox, which is monkeypox. Facts about this disease is that the monkeypox is a disease that was first isolated in 1958 from monkeys. But then the first human case, or the first case isolated in humans, was identified in 1970 in DRC, that is in Africa. And then after that, we had to get a case outside Africa in 2003. So at the moment, WHO declared Mpox outbreak in July of 2022. And then in July 28th of 2024, Uganda registered its first case here. What do we need to know about Mpox? Mpox is a zoonotic infection, meaning it's from animals, then it comes to humans, and then from humans who are infected, they can also pass it to other humans through contact. The current situation as a country, we have 11 cases and we have not registered any death. In Kigezi, we do not have a case yet, but we have suspects from which samples have been picked, and they are pending to get to know if they are cases yet or they are not cases yet. So that is the current situation that we have at the moment.
Mpox is spread by contact. When you get in contact with an infected person, especially with fluids that come from that contact person, or through kissing, or you get in contact with things that are contaminated with body fluids of an infected person, like bed sheets, or an infected pregnant woman can also pass it, the unborn baby, or if you inhale any contaminated air particles, then all the viruses, you can easily get it. Or when you get in contact with animals that are infected. As you are all aware, this is a zoonotic animal, a zoonotic disease. The disease has been in animals but can cross from animals to humans. So if you are, especially those who go to hunt in forests and you get in contact with an animal that is either has died of the disease or it is sick of that disease, you can easily get it. Is it okay? So what are the signs and symptoms? They are generally signs that are common with like any other disease. But the most prominent ones is a skin rash. For all of you, you have seen cases with prominent skin rash. They also get fever, they also get sore throat, headache, back pain, they get body weakness, swollen lymph nodes, and sometimes body aches. You get body pain. Let me use that to simpler. So, because of those some of the signs, majority of the patients, it is very, very difficult to know that they have monkeypox unless we have really investigated them and we have confirmed that this person has got monkeypox. Because even measles, if you have heard about measles or if you have seen people with measles, they can have the same rash. You can have body rash. If you have had chicken, have you heard about chickenpox? People with chickenpox, they also have the same similar signs and symptoms. That's why we don't want people to move around. When they see someone with a body rash, they quickly say that this person has got monkeypox. So you can be suspect. Then we shall pick samples. We have a system that these samples will be picked and they are able to be sent to the national lab where all viruses can be tested. Remember, this is also a viral infection that is very, very highly infectious. There are some people categories of who are at risk than others. Maybe women may not be at a very high risk because maybe they are not interacting with people who are sick. But there are those who are at a very high risk. One, those who are in close interaction with patients who have got monkeypox. If, for example, monkeypox is in a regional hospital, then we think that health workers who are attending to these cases are at a very high risk of getting this infection. If you are in Congo where cases are many, then you are at a higher risk of acquiring this infection. But also, we see those who are attending to people who are sick. You have a client with monkeypox in your home, and you are the one who is attending, whether in the hospital, you are the attendant. Therefore, you are at a very high risk of getting the disease. Also, like him, those who work in laboratories, they are dealing with samples that already have the virus. So they are at a very high risk of getting the infection. People who are children and pregnant women, because their immunity is very low, therefore they are at a very, very high risk of getting the infection. If you have many sexual partners, we say this infection is by contact, isn't it? So if you are moving, you are at Bombocha, you are where? People who go for hunting in these game parks, they are at a very high risk because we see the reservoirs for this infection, they are wild animals. You see animals like monkeys, mice, rats, squirrels. They are very good at keeping this virus. Therefore, if you are always running after them, then you are at a very high risk of getting this. Even though some people who are the others who are very at risk, who are in business, those who are moving in those areas where we have many cases, and therefore we encourage people to really try avoid movement in those places. How can we prevent this infection? We have seen how it is spread, we have seen signs and symptoms, we have seen people at risk. Is it okay? But how can we prevent? One of the preventive intervention is to avoid being in close contact with the infected person. So if you know that people have monkeypox, but they're everywhere, they don't carry them, they don't have any protection, then we're saying avoid that. Is it okay? If any case is confirmed, you should avoid it to be in close contact with that case. Secondly, you avoid touching or sharing personal items. You know that this is my colleague, we can share clothes, you can share clothing, you can sleep together. Is it okay? If you are sharing those, the beddings and other eating utensils, clothing, shoes, and any other thing that you can put on your body, and you are sharing it with someone who may be infected, then we are saying avoid that, because that one can put you at a very high risk of acquiring an infection. But also, we want you to avoid getting in contact with wild animals. Because these diseases are, they say, the reservoir for the infection is in wild animals. Therefore, we need to avoid those. So we encourage people not to get in contact with such animals that may bring such a diseases. But also avoid eating wild animals. And some people eat mice, yes, mice. And some people who eat squirrels, and even those who eat monkeys. We really avoid that. Also, we can have the vaccine. We have the vaccine that is available, although it's not widely now available for everyone. So if you can also get vaccinated, is also very important. Lastly, hygiene. Hygiene is very, very important for prevention of some of these diseases. So, as I said, this disease is not identified by just looking well. Is it okay? We must test and confirm that this person has got a disease. For example, we don't have any case in the Kabale district. I don't want to see you reporting that Kabale district has reported 20 cases.